Childhood trauma isn't always about huge dramatic moments. More often, it's the smaller, confusing, or painful experiences that happen when you're young that quietly stick with you far longer than expected. These can include things like not feeling safe in your own home, not getting enough love or attention, or growing up in an unstable or chaotic environment. These early experiences shape how you think, feel, and act, even years later, well into adulthood, sometimes without you even realizing it. Trauma can come from many different situations. It might be abuse, physical abuse like hitting or pushing, emotional abuse like constant criticism or rejection, or the kind of abuse that's really difficult to talk about, like sexual abuse. Trauma can also come from neglect, when a child's basic needs for food, care, comfort, or emotional connection aren't met consistently. Sometimes trauma is about loss, like when a parent leaves, dies, or is absent for other reasons. Living in a home filled with conflict, addiction, or mental illness can also be traumatic. Even if these things didn't seem huge at the time, or didn't happen all at once, if they happened repeatedly or over a long period, they can deeply affect how the brain develops and how emotions are processed. The brain's natural response to trauma is to try to protect itself, but sometimes this protection comes with a cost. The way trauma shows up can look very different depending on the person, but there are some common ways it affects emotional, mental, behavioral, and even physical health. Emotionally, trauma can cause feelings of anxiety, sadness, or numbness. You might experience mood swings or feel overwhelmed by situations that others handle easily. For example, someone who grew up with emotional neglect might develop depression, feeling a persistent emptiness or hopelessness that's hard to shake. Sometimes people struggle to regulate their emotions, going from feeling fine one moment to suddenly feeling intense anger, fear, or sadness the next. Trauma can also make it hard to feel safe emotionally, which affects how someone connects with others. In relationships, trauma can make it difficult to trust. You might constantly worry that people will leave or hurt you, which can make you either cling too tightly or push people away before they get too close. These difficulties are common in people with attachment disorders or borderline personality disorder. Because early relationships were unstable or unsafe, it can be hard to build healthy bonds later on. This fear of abandonment or rejection can be exhausting and confusing. Mentally, trauma can cause negative self-talk, where you believe you're not good enough or blame yourself unfairly for things that aren't your fault. Some people develop obsessive-compulsive disorder, OCD, as a way to try to control their environment or reduce anxiety caused by trauma. Others might become perfectionists, thinking that if they can just do everything right, they won't get hurt or rejected. Trauma can also make it hard to focus or make decisions, leading to feelings of confusion or brain fog. Behaviorally, trauma survivors might avoid situations that remind them of the past, or they might take risks to numb emotional pain. Substance use disorders like alcoholism or drug addiction often have roots in childhood trauma because substances can temporarily block out difficult feelings. Some people turn to self-harm or develop eating disorders as a way to cope with overwhelming emotions or to feel some sense of control. Trauma can even show up physically. Many people with childhood trauma experience headaches, stomach problems, chronic pain, or other illnesses that doctors can't explain. This is sometimes diagnosed as somatic symptom disorder, where emotional pain expresses itself as physical symptoms. The mind and body are connected, and trauma can affect both deeply. These emotional, mental, behavioral, and physical reactions are often linked to specific mental health conditions. Post-traumatic stress disorder, PTSD, and complex PTSD are closely connected to trauma. PTSD usually happens after a single traumatic event, while complex PTSD results from ongoing trauma over time. Symptoms include reliving traumatic memories, feeling constantly on edge, avoiding anything that reminds you of the trauma, and having trouble trusting others. Depression and anxiety disorders are very common among trauma survivors, often overlapping with other conditions. Borderline personality disorder involves intense, rapidly changing emotions and fears of abandonment, often connected to unstable early relationships. Attachment disorders affect how people relate to others and can cause difficulties in forming healthy emotional connections. Obsessive-compulsive disorder, OCD, eating disorders, and substance use disorders can also be linked to childhood trauma as ways the brain tries to cope with or control overwhelming feelings. So why does childhood trauma stick with someone for so long? When you're a kid, your brain is still learning how to handle emotions, stress, and relationships. Trauma can literally rewire the brain, changing how it processes feelings and reacts to the world. The coping strategies that helped you survive as a child, like shutting down emotions, staying hyper-alert, or trying to control everything, might have kept you safe back then, but those same strategies can make adult life much harder. That's why old wounds sometimes pop up unexpectedly, causing strong reactions to seemingly small triggers. It can feel like you're stuck in patterns you don't understand or can't control. But it's important to know these patterns come from a place of survival and adaptation. Healing from childhood trauma is definitely possible, even if it feels overwhelming at first. Therapy approaches like cognitive behavioral therapy, CBT, help by teaching new ways to understand and manage your thoughts and feelings. Eye movement desensitization and reprocessing, EMDR, is another therapy that helps process traumatic memories so they don't have the same emotional power over you. Other therapies focus on building healthy relationships and learning new coping skills. It's important to remember that experiencing trauma doesn't mean you're broken or weak. It means you adapted to survive something really tough. Taking steps toward healing might feel scary or slow, but it's worth it. Everyone deserves to feel safe, understood, and free from the weight of their past. Healing isn't about forgetting what happened. It's about learning to live fully despite it.